Why do mothers stop treatment? Do long lines, stressed staff and poor services put them off? This intervention uses continuous quality improvement to train healthcare workers to identify, implement and evaluate improvements in their facilities. Bottom-up change, the idea goes, is likely to be more effective at improving patient satisfaction.
When clients are satisfied, we know that they would not just come back to the facility, thereby enhancing retention, but they also become advocates for others to really come in and utilize the services.
Vaccinations, family planning, ART, early infant diagnosis, multiple visits for mothers mean many lost days at the health centre. This idea is to integrate services for HIV-positive mothers and their infants and combine all of these visits into one weekly clinic.
The idea is that the less visits that the mother has to come, the more likely that that mother will come for that one visit that she would get everything.
If mothers miss an appointment, in this intervention, healthcare workers SMS a community volunteer chosen from the village health committee who will go to the mother's house to remind her. Do mothers starting treatment the day they test positive really understand why they're taking medicines? Would better knowledge improve retention? This project uses enhanced counselling around CD4 testing to educate about HIV and the immune system. In this initiative, HIV-positive mothers help each other in groups to learn about HIV and live positively. These health centre-based peer support groups are led by nurse-trained and supported mothers. They meet at least 8 times using standardised education, role plays, song and dance.
Mentor mothers are women who are living with HIV and they have personal experience in being in PMTCT programs. But what distinguishes them is that they are also trained.
Well-trained, supervised and supported full-time mentor mothers provide long-term individual peer support. Based in health centres, they counsel, organise support groups and do home visits to trace mothers who drop out of treatment. Expert mothers play the same role as mentor mothers, but they're community-based, allowing them to counsel clients at home around family issues.